Welcome to Complete Health with Dr. Mike Rogers. This is April, and I am here today discussing a danger while you sleep with Dr. Mike Rogers. Good morning, Dr. Rogers.
Good morning, April. How are you today?
I'm doing well.
Did you get a good night's sleep last night?
I did, thank you.
Awesome.
Can you begin with explaining what sleep does for our bodies?
Well, what sleep does is sleep restores. It increases energy, improves our immune systems, it improves memory and concentration, regulates hormones, growth and satiation, meaning eat, hunger, enhances our mood, reduces the effects of stress, inhibits pain. And sleep falls into two categories, REM and non-REM sleep, and both are needed for a good night's sleep.
How many hours of sleep should people get?
Babies can require 16 or more hours. Teenagers really should get 9 hours or more, and they rarely get that. And then adults should ideally get between 6 and 8 hours. 7 hours is the sweet spot, so to speak.
I don't know. 8 hours is my sweet spot.
If you get less than 6 or more than 8, it actually can increase the likelihood of mortality or death. And then also, if you get 5 hours or less regularly, it actually doubles the risk of cardiac death.
Wow, so sleep really is important.
It is.
This danger while you sleep apnea, what is that?
Well, sleep apnea is defined as when one stops breathing during sleep or takes less than 25% of a normal breath for at least 10 seconds.
Are there different kinds of sleep apnea?
Yes, there are. There's 3 different kinds. One is a obstructive sleep apnea, where there is a blockage or an obstruction in your airway. There's central sleep apnea, where your brain just forgets to take a breath. Our body just doesn't remember to do that. And a combination of both types of sleep apnea.
Okay. The central sleep apnea, that would be our oldest had apnea when she was first born, right? As a preemie?
Yes.
So she was forgetting to take a breath until she matured a little.
Correct.
Interesting.
She grew out of that. Yes.
So what is obstructive sleep apnea?
Well, this is actually the most common type of apnea. It's between 80 and 84% or 85% of the people who have sleep apnea. Primarily, it's caused by a blockage in the airway. Say the relaxation during sleep causing the soft tissue in the back of our throats will collapse and block the airway. And this falls under the heading of sleep disordered breathing. It consists of a hypopnea, which means that 50% reduction in the airflow that gets to our body or into our lungs, and an apnea, which is greater than or equal to 10-second stoppages of air.
Wow.
Moving into our lungs. So, I mean, you can have even longer than 10 seconds, but 10 seconds is the minimum, or a decrease of less than 25% of the air. And then just some interesting statistics. You know, it's estimated that 17 to 20% of adults in the U.S. have sleep apnea. And that kind of equates out to 15 million Americans have sleep disordered breathing, and 90% of those are undiagnosed, making it more common than diabetes and asthma.
That's staggering. It
is, and it's also associated with a lot of car accidents or tractor-trailer accidents.
Does snoring mean that I have sleep apnea?
Not necessarily. It can, but snoring is usually a symptom of sleep apnea, and you should be checked out to see if you have sleep apnea if you do snore.
Dr. Rogers, why do you screen for and treat sleep apnea?
I had a patient that I'd known for about 15 years. Every time he'd come in, I'd discuss with him the use of his CPAP. And he'd put it off. And eventually, at the age of 45 or so, he passed away in his sleep due to a heart attack. And I took that very personally. And just to see the ramifications of how this problem can just go right through a family, it really affected me. And I vowed never, ever to step over that again and to screen people in my office, because it's something we can fix.
Wow, that's great. I admire you for that.
Thank you.
So most people think that snoring means that you have sleep apnea, but when we come back, we are going to talk more about all the other symptoms of sleep apnea and what to do if you do have sleep apnea. You're listening to Complete Health with Dr. Mike Rogers. Do you snore? Do you wake up tired? These are signs of sleep apnea. Obstructive sleep apnea afflicts 1 in every 5 Americans. This can lead to stroke, stress on the heart, and even sudden death. Did you know that dentists can treat sleep apnea? Hi, I'm April at Complete Health Dentistry of Northeastern PA. Dr. Rogers uses oral appliance therapy to help patients manage their snoring and sleep apnea. Oral appliances resemble a sports mouth guard, and they are an effective alternative treatment to the CPAP machine and mask that is traditionally prescribed. Our patients prefer oral appliances because they're comfortable, easy to wear, quiet, portable, and easy to care for. If you have been diagnosed with sleep apnea by your physician but are unable to wear a CPAP, give us a call to discuss alternatives for you. 253-5000.
Complete Health Dentistry, transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. Dr. Rogers, before the break, you explained to our listeners what sleep apnea is. How do you know you have it? Like, what are the symptoms that you look for?
Well, one of the biggest ones that we look at is if someone, your significant other, tells you that they've seen you stop breathing while you sleep. I mean, that's a big red flag. Woohoo, 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 that something's not right. If you're stopping when you're sleeping, snoring's one thing, but if you're stopping breathing while you're sleeping, that's a big red flag that your body's not getting oxygen. And then it creates a whole cascade of effects. Daytime sleepiness is another symptom that people can address or assess for themselves. Fatigue during the day as well. You know, do you go to sleep tired and wake up tired? Another big one is acid reflux or GERD. You know, the digestive system itself, when we try and breathe, if our body has to force hard to get air in, it can constrict our stomach and create this acid reflux or this GERD. So things like that are all symptoms. Other symptoms fall into 2 categories, pretty much. Parasomnias, which is rising from sleep, meaning you're startled or you wake up from your sleep. The other is dysomnias, where it's difficult to get to sleep or to stay asleep. And other things include snoring, restless sleep, nighttime teeth grinding, night terrors, bedwetting, narcolepsy, periodic leg movement disorder, restless leg syndrome, and also we look at other warning signs on people themselves.
Like, what do you look for?
Well, one is, are the patients overweight? Do they have a BMI, which is a body mass index, greater or equal to 30 and on the scale of body mass indexes? Large necks of people. If it's bigger than 15 inches, either men or women, we start to discuss this in our office because it's a big concern for me. Elevated blood pressure and blood pressures that are hard to control. Your age, the older you are, the more susceptible you are because things aren't as tight and toned as they were when you were younger. If you have been diagnosed with sleep apnea, if you have enlarged tonsils are another thing, because what happens there is if you're breathing through your mouth or you're snoring, all that air is coming in past the tonsils, which is a protective device in our body. It's not being warmed and sterilized and bacteria eliminated going the normal way through our nose. And so the tonsils become inflamed, infected, and enlarged. Large tongue. You know, if our tongue is bigger than what it can fit in our mouth, then we look at that. Waking up in the morning with headaches. You know, we shouldn't have headaches. Headaches is a symptom of something else. And so there too, we need to be looking at that. Do you wake up with headaches? Do you have constant headaches? Being irritable, just in general, just having a grumpy disposition could be a symptom of not breathing well while you're sleeping or sleep apnea. Depression, learning and memory difficulties are also symptoms. These are all significant things. And sexual dysfunction. You know, the thing is men are 3 times more likely to develop sleep apnea than women.
So are all people with sleep apnea overweight?
No, I know it sounds like that these are criteria that we have. One of the things that we do is you've got to take into account everything that I just went through, and then also see, is there other medical conditions that could go back to sleep and sleep problems causing all of this for us? So no, you don't have to be overweight. And the other thing is, no, you don't have to snore. There's a condition called a silent apneic, where people don't snore, but they're a sleep apnea concern, but they don't have that telltale snoring problem. So it's just a ticking time bomb ready to go off at some point, one way or another.
Wow. Are there dental signs that you look for to determine sleep apnea?
Well, one, we look for a very deep bite or overclosed bite. Narrow arches, meaning our teeth aren't lined up in these big, broad arches. They're very narrow. A very high vaulted palate can be an indication of airway issues as well. The other thing, very flattened, ground down, or worn down teeth can indicate grinding and clenching at night, which, as I had mentioned earlier, can be a symptom or a side effect of sleep apnea. People with scalloped tongues, meaning the tongues have notches on the side if you stick it out, because it's wedged down in between our teeth, and it creates this form of notches in the side of our tongue. An open mouth posture is another one.
What do you mean by open mouth posture?
Well, if you're not in a proper resting position, meaning your tongue not sitting right up in behind your top front teeth in a rest, or if your mouth is slightly open, or you spend a lot of time with your mouth partially open, you can actually develop a low tongue posture, which can increase the likelihood of airway issues and breathing through your mouth, which can contribute further to these other things, sleep apnea and such. That lower, having an open mouth posture can also create a longer looked face, someone with a longer face. The other is that we look for is a forward head posture in a person, or what we call a retrognathic mandible, meaning there's not a strong chin or a strong jaw. It kind of sits back in. That can also contribute to or be a sign of it. Missing back teeth we also look for as creating an issue there.
So is there a test to determine if you have sleep apnea? And if so, can it determine the severity of it?
There are two screening exams we do in our office. One is called a stop bang, and the other one is called the Epworth Sleep Questionnaire. And I'll start with the Epworth. The Epworth is questions on how likely you are to doze or fall asleep under certain situations or conditions. The Stop Bang is actually an acronym for a whole series of things that we look for in measurements, and then we can evaluate better. Is the person a candidate for potentially sleep apnea, or do they have potentially sleep apnea? In the dental office, we can't diagnose sleep apnea. Only the medical doctors can, and they need to have a sleep test in order to do that. So what Stop Bang stands for is the S stands for snoring. Do you snore? The T stands for tired. Are you tired during the day? Or O is, has anybody observed you stop breathing while you sleep? P stands for blood pressure, if that's elevated or difficult to control. B in the bang starts BMI. We've talked about that. A stands for age. If you're over 50, that's a concern. N stands for neck circumference. We talked about how wide or how thick is our neck. And G is gender. Are you male or female? Because as I was saying earlier, you're 3 times more likely to have sleep apnea if you're a male than if you are a female. The only true way to determine if you have sleep apnea is to have a sleep test done, and that's called a polysomnogram or a PSG. And there are different types. The primary ones are done in a sleep lab, but now more and more are doing a take-home test where you can actually bring this piece of equipment home, hook it to your wrist or your body in one way, shape, or form and actually have the test done at home.
How do you determine which test to order? And is this test something that you can order?
Well, I wish I could because we see our patients so frequently, but these tests are decided on by your physician, and he's the only one who can order them. And he'll either send you to a sleep lab to do the tests there in the sleep lab, or he can have you sent to a sleep lab and have the equipment, or have the equipment sent to your house and have a home sleep test done. These tests determine what's called an AHI. AHI stands for Apnea Hypopnea Index. And what an apnea hypopnea index is 0 to 5 is normal. So if you've got 5 of these in an hour, it's within the normal range. 5 to 15 is mild sleep apnea, and 15 to 30 is moderate, and anything greater than 30 is severe.
So what do those numbers mean, 0 to 5 or over 30?
What they mean is it's a count on how many times you've stopped breathing in an hour, or you've had a depressed amount of breathing in that same hour throughout the night. And it's averaged throughout the series, or the test follows you as you sleep through the whole night, and then they can determine what your average is, and that's what it is. And I've got patients who have had these polysomnograms and are over an AHI of 100. So that's over 100 times an hour they're stopping breathing for at least 10 seconds. So, I mean, it's significant in some people that you wonder how these people are functioning.
You're listening to Complete Health with Dr. Mike Rogers. When we come back, Dr. Rogers will discuss what can happen if you have sleep apnea and what to do if you have it.
Complete Health Dentistry.
Do you snore? Has your spouse told you they have seen you stop breathing while you sleep? Did you know that sleep apnea leads to many medical problems such as heart attack, stroke, diabetes, and even cause death? At Complete Health Dentistry of NEPA, we screen all of our patients for this hidden danger while you sleep. If your screening indicates an airway problem, we can work along with your physician to get you the help you need. If you have already been diagnosed with sleep apnea and can't or are unable to wear your CPAP, Dr. Rogers can help as well. Don't go another night without this life-saving help. Call Dr. Rogers at 253-5000 to schedule your appointment.
Complete Health Dentistry. Transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. Dr. Rogers, you've explained what sleep apnea is. What can happen if I have sleep apnea? Like, what types of problems does sleep apnea create?
There are many things that can occur because of sleep apnea. I group them into pretty much 4 categories themselves. One is cardiovascular. And what can happen is with sleep apneics or people with sleep apnea, it can increase your blood pressure, elevate blood pressure, create an uncontrolled blood pressure issue. Heart failure is a significant aspect of it. Cardiac arrhythmias. These are all caused by vibrations from snoring affecting the health or the tonus, the flexibility, and the muscle ability of the carotid artery. And it increases the wall thickening. It can also lead to having to go to the bathroom in the middle of the night and even erectile dysfunction. So I know people look at those little blue pills as saviors for that part, but there's usually an underlying condition, some type of vascular issue going on, and it could certainly be sleep apnea. So it's a question to ask your physician when you go for those little blue pills. The second one is cerebrovascular, meaning brain health and the vascular or the blood supply to the brain and from the brain. Patients with moderate to severe sleep apnea, so that's anywhere, say, from 15 to over 30 on an AHI, they are more likely, 3 times more likely to have a stroke within the next 4 years or so after being diagnosed. And this is because it activates the parasympathetic nervous system, which is the fight or flight nervous system, once again increasing the thickness of the carotid wall and increasing fibrinogen, which creates the clots, and it just creates a whole cascade of issues, increasing and elevating high blood pressure. Number 3 is metabolic issues, such as diabetes due to insulin resistance, increased weight gain, effects of hormones by suppressing leptin, which is a hormone that suppresses hunger, and increasing ghrelin, which triggers hunger, and then it also increases cortisol, which helps us hold on to fat, which increases or leads us to insulin resistance and glucose intolerance. And then
So that makes perfect sense then, because you said you don't have to be obese or overweight to have sleep apnea, but sleep apnea can in turn cause you to be overweight.
Exactly. They feed off of each other. There's so many things that all feeds off of this, and there's an inflammatory aspect to it as well as a metabolic issue here. The last part, point 4 of this, is quality of life issues. You've got an increased fatigue, decreased in coping skills, and inability to complete repetitive motions or tasks. So if there's a decrease in your ability to do things, you could be having sleep issues. An angry spouse, if you're snoring and they have to sleep in another room, or they're making you sleep in the other room. And then problems driving, as we discussed with the accidents before. There's such a big issue with truckers and people falling asleep behind the wheel of their car.
So now I've been diagnosed with sleep apnea. What are the treatments out there available? Well,
treatments range from surgery, a CPAP, which is a continuous positive airway pressure machine.
That's the mask that you wear, right?
I don't wear one, but yes, right. that people would wear to pump oxygen in, and it bypasses or puts so much pressure on it, that's the positive airway pressure, so that it forces the air into the lungs. So people have to get oxygen in. And that is pretty much 100% effective. That is the gold standard of that.
As long as you wear it.
As long as you wear it, and if you can get comfortable with it. I've got so many patients that say, you know what, I have this thing, I just don't wear it because it's uncomfortable. I'm tethered to this machine, and my wife or my spouse hates me wearing it, and you hear it all night long pumping air. The other one, and my personal favorite, is we call them OATs, or MADs, M-A-D. So O-A-T or M-A-D. What an OAT is an oral appliance therapy, or a MAD is a mandibular advancement device. And
mandibular meaning it goes on your bottom teeth, correct? Lower jaw?
Yes, it goes on the bottom and the top teeth, actually.
Okay.
And but it's causing your jaw to be pulled forward. And what that does, just like in CPR, where there's a technique that if there's a suspected neck injury, it's called a jaw thrust. You actually pull the jaw forward to open the victim's airway. And so what this appliance does, is you put a piece in on the top of the mouth, you put a piece on the top teeth, you put a piece in on the bottom teeth. And what it does is you actually adjust that to the point where all your symptoms start to be eliminated. And then we recommend afterwards that you go for another sleep test to corroborate where we've got you, to make sure you're in a good spot and you're oxygenating well.
Okay, so the CPAP you said is basically, as long as you wear it, it's 100% effective. And that's the number one go-to method. So what if I can't wear the CPAP? What would my other option be?
It would be that mandibular advancement device, or the OAT, the oral appliance that we would make. And what that does, that we make them in our office. We take molds, we develop them up, and we actually work with the patient they would wear this appliance while they sleep. It's not uncomfortable, and you're not tethered to anything, but what it does, it advances or pulls your jaw forward to open your airway. It helps eliminate or decrease or eliminate the snoring, and it opens the airway just like in rescue breathing for CPR. It opens an airway. When we breathe through our mouth, that's a pathologic condition, as we talk about. The other thing is That's an emergency condition when we breathe through our mouth. It's not a normal physiologic. Our normal physiologic breathing is through our nose.
So how effective is that?
It's very effective for people with mild to moderate sleep apnea, so 5 to 15 and even 15s to 30s on the AHI scale. We can make these appliances and have a very effective result with it that you wouldn't need a CPAP. So it's something you'd have to talk to your physician to see if they'd be willing to have you have an oral appliance made. The other is we have made them for people with severe sleep apnea, and it does help. I'd rather see someone who is not going to wear or never going to wear a CPAP, and it just sits there collecting dust. It'd be better to get them partially oxygenated wearing an appliance. It's not ideal, but it's better. The other thing is, one of the complaints with CPAP is the oxygen, or the pump is pumping so much oxygen to get it into their lungs that having a combination, a CPAP and an oral appliance, can actually decrease or minimize how much oxygen has to be pumped, because it helps open the airway. So also using it in combination with a CPAP is also an option as well.
So we're almost out of time, Dr. Rogers. Are there any things that we can do, or our listeners can do now, to help get a better night's sleep, even if you don't have sleep apnea but have trouble sleeping?
Yes, there are. It's a process called sleep hygiene, and there's things you can do before you go to sleep or during sleep. One, prior to sleep, is drinking liquids too close to bedtime.
So don't drink liquids.
Correct. Lack of exercise. These are all problems, and it can increase. Lack of sunlight, it affects the melatonin production. Medications and nicotine can create problems. Technology in our bedrooms, TV and iPads, can throw off our circadian rhythms and fool our brain into thinking it's daytime or having overstimulated.
And that would include cell phones too, wouldn't it?
Yep, cell phones are a big issue, and once again, cell phones themselves, because if they're on all night and they're close to you, they're receiving and sending information 24 hours a day, and our bodies can pick up on that. And so if they're within closer than 8 to 10 feet away from your head, it can affect your sleep. Napping during the day can affect your sleep. Caffeine, alcohol may help you fall asleep. People go, oh, I fall asleep better but you're not going into the proper depth of sleep, the REM, the non-REM sleeps that you're supposed to be. Big or spicy meals too close to bedtime, your body diverts blood to your digestive system, and it affects how your body can sleep. It can't sleep as effectively while it's doing all that other work. Eating in bed, our bodies then become used to or accustomed to this is what bed is for, as a dinner table. During sleep, pets in the bed, with the interruptions that they create, can affect your sleep. Ambient noises, meaning noises from outside the house or inside the house, can affect your sleep. Snoring of your bed partner. Ambient light, meaning your room should actually be as dark as possible, because any light in the room can actually affect how our body reacts to sleep, daytime and nighttime. And if the bedroom is too warm, ideally, it's 68 degrees or less. Stress and anxiety medications can affect your sleep. Cell phones, as we talked about, children interrupting your sleep, allergies, uncomfortable mattress, all of these things can affect how we sleep. And those are things that we can change ourselves. The bedroom should be kept for two things only. One, sleep, and two, to spend quality time with your significant other. All these other things should be left out of the bedroom and kept away if you want to get a good night's sleep.
Thank you, Dr. Rogers. This was great information. You have been listening to Complete Health with Dr. Mike Rogers.